Have you been told you need an injection in your eye, or are you currently receiving treatment for a retinal condition? I'm Dr. Michael Chua. I'm a board-certified ophthalmologist, and in this video, I'll discuss everything you need to know about intravitreal injections. I'll talk about why they're needed, how the procedure is done, the different types of medications, the risks involved, and what to expect during the whole process. By the end of this video, I want you to know as much about intravitreal injections as the surgeon doing them for you. So what are intravitreal injections? Alright, let's discuss what an intravitreal injection is and why it's such a common and effective treatment. Here's a cross-section of the eye. The large back portion of the eye is filled with a clear jelly-like substance called the vitreous humor. Just behind the vitreous is the retina, the light-sensitive tissue that acts like a camera sensor. An intravitreal injection is a procedure where medication is delivered directly into the vitreous space using a very fine needle. Why do we do this? By placing medication inside the eye, we can deliver a high concentration of the drug directly to the retina where it's needed most. This allows us to treat serious retinal conditions far more effectively than with eye drops or pills, which don't penetrate to the back of the eye in sufficient concentrations. The most common diseases we manage with intravitreal injections include wet age-related macular degeneration, or AMD. This is a condition where abnormal leaky blood vessels grow underneath the macula, causing fluid and blood to build up, which leads to rapid and severe central vision loss. Diabetic macular edema, or DME. In patients with diabetes, high blood sugar can damage the retinal blood vessels, causing them to leak fluid into the macula. This swelling, or edema, blurs central vision. Retinal vein occlusions. This occurs when a vein in the retina becomes blocked, causing blood and fluid to leak into the retina and also cause macular edema. When your ophthalmologist recommends an injection, it's based on a very thorough evaluation. During your visit, we perform a series of tests to diagnose and monitor your condition. This includes checking your vision and your eye pressure, followed by a fully dilated exam to get a clear view of your retina. The most critical imaging test we use is optical coherence tomography, or OCT. This is a non-invasive scan that uses light waves to take high-resolution cross-sectional pictures of your retina. And OCT allows us to see the individual layers of the retina and precisely measure any swelling or fluid. It's the key tool we use to decide if an injection is needed and to track your response to treatment over time. We may also perform a fundus photograph, which is a picture of your retina, and that allows us to document and track bleeding and swelling in the back of your eye. So how are intravitreal injections performed? I know the thought of getting an injection into the eye can be scary, but the procedure is very quick and we take every step to make sure it's as comfortable and as safe as possible. Intravitreal injections are performed in the office like this, not in a special operating room. First, we numb the eye thoroughly using anesthetic eye drops. You might receive several rounds of these drops to make sure the surface of your eye is nice and numb. Next, we clean the eye and the surrounding eyelids with an antiseptic solution, usually betadine. This step is super important for preventing infection. We then place a small device called an eyelid speculum to gently hold your eyelids open. This prevents you from blinking or squeezing your eyes during the procedure. We'll ask you to look in a specific direction away from where the injection is going to be given. And using a very thin, short needle, we perform the injection through the sclera, which is the white part of your eye. The injection itself only takes a few seconds. Some patients may feel a quick pinch, kind of like that pinch when you get a vaccine. After the injection, we remove that speculum, and the entire process is only a few minutes. Like any medical procedure, we need to discuss the risks and benefits. The primary benefit of intravitreal injections is preserving and in many cases, improving your vision. Before these injections were used in clinical practice, the expectation was that people diagnosed with conditions like wet AMD would just go legally blind. Now, with these injections, we can manage this condition, allowing millions of people to maintain their sight and independence. While the procedure is overwhelmingly safe, it's important that you understand the potential risks. I'm about to go through a comprehensive list, but remember that serious complications are rare. The most common side effects are minor and temporary. You might experience a foreign body sensation or scratchiness for a day or two. You may also see a subconjunctival hemorrhage, which is a bright red spot on the white of the eye. While it can look alarming, it's just a small bruise on the surface of the eye and it's harmless. It resolves on its own in about a week. Many patients may notice new floaters immediately after the injection, which could be small air bubbles or the medication itself swirling around inside the eye. And usually these disappear within a few days. The most serious complication we watch for is an infection inside the eye called endophthalmitis. It's rare, but it's a vision-threatening complication. Large-scale clinical trials and registries, such as the analysis from the DRCR Retina Network, have shown the rate of endophthalmitis to be extremely low, in the range of 1 in 2,000 to 1 in 5,000 injections, or about 0.02% to 0.05%. The sterile technique we use, particularly the application of betadine, is the most important factor in preventing infection. Other rare but serious risks include a retinal tear or retinal detachment, a significant increase in eye pressure, or the development of a cataract over time with repeated injections. While the list of complications can sound intimidating, intravitreal injections are one of the most common medical procedures performed in the world, and they have an excellent safety profile. For many patients with vision-threatening retinal disease, the benefits of the treatment usually outweighs the risks of the procedure. There are several classes of medications that we can inject, depending on your specific condition. Anti-VEGF agents. This is the most common class of medications used. VEGF stands for vascular endothelial growth factor. It's a protein that signals the body to create new, often abnormal and leaky blood vessels that we see in conditions like macular degeneration and diabetic eye disease. Anti-VEGF drugs block this protein, which helps to dry up the fluid in the retina and shrink these harmful vessels. Common anti-VEGF medications include Avastin, Eylea, and Vabysmo. Another class of medications we can inject are steroids. Corticosteroids are powerful anti-inflammatory drugs, and we would use them to treat macular edema caused by diabetes, vein occlusions, or uveitis. In the rare case of an eye infection like endophthalmitis, we inject antibiotics or antifungal medications directly into the vitreous to fight the infection. Okay, what to expect on injection day. On the day of your injection, you can eat and take all of your regular medications as you normally would. Since it's a quick in-office procedure, you typically don't need a driver, although many patients prefer to have one, at least for their first visit, just in case their vision is blurry afterwards. Your appointment will usually involve a vision check, an eye pressure measurement, and an OCT scan to see how your retina is looking. You'll then be brought into the procedure room where we'll perform the injection like we described earlier. The amount of time you spend in the office can vary depending on whether you need a full dilated exam, but in general, you'll probably spend about an hour in the office. Okay, post-injection instructions. After the injection, your eye may feel a bit scratchy, irritated, or watery for the rest of the day. We recommend you take it easy. The most important instruction is don't rub your eye. You can shower, you can wash your face, but try to avoid getting soap or tap water directly into that eye for the first 24 hours. Obviously, we want to try to avoid any sorts of infection. We also recommend you avoid swimming pools, hot tubs, or lakes for about 3 days, also to just minimize the risk of infection. Using artificial tears can also help to soothe any irritation. Okay, post-injection symptoms. Let's talk about what's normal and what's not. It's crucial to know which symptoms are normal and which are warning signs of a problem. Normal symptoms include mild aching or discomfort, a red spot on the eye, the appearance of bubbles or floaters in your vision, and some mild blurriness. These usually improve over the next day or two. Concerning symptoms that require you to call our office immediately include severe and worsening eye pain, a significant decrease in your vision, a shadow, a curtain, or shade in your field of vision, a sudden increase in flashing lights or a shower of new floaters, increasing redness and sensitivity to light. These can all be signs of a serious complication like an infection or retinal detachment and require immediate attention. For most retinal conditions, intravitreal injections are not a one-time cure, but rather an ongoing therapy to manage a chronic disease. Initially, you may need injections as often as every month. As your eye responds and the retina stabilizes, we often move to a treat and extend protocol. This means that your ophthalmologist may gradually increase the time between your injections as long as your OCT scan remains dry and your vision is stable. The goal is to find the longest interval that keeps your disease controlled, which minimizes the number of office visits and injections you need per year. Regular follow-up is really important to maintaining your vision long term. Okay, so that was a thorough overview of intravitreal injections. I hope this video answered many of your questions and helped you to ease any anxiety you might have about the procedure. If you found this information helpful, please give us a like and subscribe to the channel for future updates. And if you live in the Los Angeles, Orange County, or Inland Empire area and want a retina evaluation, feel free to visit our website or give our phone number a call to make an appointment today. I'm Dr. Michael Chua. See you next time.